Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Sentinel-Lymph-Node biopsy alone or with lymphadenectomy in cervical cancer. Background. Limited data are available on survival outcomes after sentinel-lymph-node biopsy alone, as compared with lymphadenectomy in cervical cancer. Conclusions. In patients with early-stage cervical cancer, sentinel-lymph-node biopsy alone was non-inferior to lymphadenectomy with respect to disease-free survival, and was associated with fewer complications. A Phase 3 trial of Telitacicept for systemic lupus erythematosus. Background. Telitacicept, a new dual inhibitor of the cytokines B lymphocyte stimulator, BLyS, and APRIL, a proliferation-inducing ligand, showed efficacy in adults with active systemic lupus erythematosus, SLE, in a Phase 2b trial when added to standard therapy. Conclusions. In this 52-week trial involving participants with active SLE who were receiving background therapy, the incidence of a clinical response was higher with telitacicept than with placebo. However, the incidence of upper respiratory infections, reduced immunoglobulin levels, and injection site reactions was also higher with telitacicept. Long-term safety and efficacy of gene therapy for adenosine deaminase deficiency. Background. Severe combined immunodeficiency, SCID, due to adenosine deaminase, ADA, deficiency, ADASID, is a life-threatening inborn error of immunity for which lentiviral gene therapy has been investigated in clinical trials. Conclusions. These long-term findings in a large patient cohort show the sustained clinical efficacy and safety of autologous CD34 plus hematopoietic stem cell lentiviral gene therapy for ADASID, indicating that it is a curative treatment. Mass administration of azithromycin to infants in Mali to reduce mortality. Background. Mass administration of azithromycin to children 1 to 59 months of age has been shown to reduce mortality among infants and children in this age group. In some areas of sub-Saharan Africa, the largest effects have appeared to be among infants younger than 12 months of age, within 3 months after treatment. This observation motivated the design of the current trial to conclusions. Mass administration of azithromycin in Mali, limited to infants 1 to 11 months of age, did not result in lower infant or child mortality than placebo, regardless of whether azithromycin was delivered twice yearly or quarterly. Next, we will be discussing articles from Journal of American Medical Association. Intra-Arterial Alteplase, after successful endovascular reperfusion in acute stroke. The Pearl randomized clinical trial. Question. Does intra-arterial alteplase after successful reperfusion by mechanical thrombectomy improve functional outcomes in patients with acute, anterior circulation, large vessel occlusion stroke? Findings. In this randomized clinical trial that included 324 patients, 44.8% of patients in the intra-arterial alteplase group achieved a modified Rankin scale score of 0 or 1 at 90 days, indicating an excellent outcome, compared with 30.2% in the standard treatment group. This difference was statistically significant. Adjusted risk ratio, 1.45, meaning among patients with acute anterior circulation, large vessel occlusion stroke who achieved successful endovascular reperfusion by mechanical thrombectomy, intra-arterial alteplase resulted in a higher likelihood of excellent functional outcome at 90 days. Next, we will be discussing articles from Annals of Internal Medicine. Effectiveness of recombinant herpes zoster vaccine in the U.S. Medicare population. 2018 to 2019, by immunocompetence and prior receipt of live zoster vaccine. Background: recombinant zoster vaccine, RZV, was preferentially recommended over live zoster vaccine, ZVL, starting in 2018. Objective: to assess RZV effectiveness using target trial emulation, accounting for prior receipt of ZVL and immunocompetence. Conclusion: recombinant zoster vaccine is effective in older adults, including immunocompromised adults, and 2 doses were more effective than 1. Prior ZVL recipients should be revaccinated with RZV. Next we will be discussing articles from British Medical Journal. Sodium glucose cotransporter 2 inhibitors and risk of autoimmune rheumatic diseases, population-based cohort study. Abstract: objective to evaluate the use of sodium glucose cotransporter 2, SGLT2, inhibitors and risk of autoimmune rheumatic diseases in adults with type 2 diabetes. Conclusions: in this large cohort of adults with type 2 diabetes, SGLT2 inhibitors were associated with an 11% lower risk of autoimmune rheumatic diseases compared with sulfonylureas. These results suggest that SGLT2 inhibitors may contribute to reducing the risk of autoimmune diseases. This potential benefit, however, should be carefully weighed against known adverse events and concerns about tolerability. Replication in other populations and settings, as well as studies in patients with existing autoimmune rheumatic diseases, are warranted to confirm and extend these observations. Next we will be discussing articles from Lancet. The Global, Regional, and National Burden of Cancer, 1990 to 2023, with forecasts to 2050, a systematic analysis for the Global Burden of Disease Study 2023. Background: cancer is a leading cause of death globally. Accurate cancer burden information is crucial for policy planning, but many countries do not have up-to-date cancer surveillance data. To inform global cancer control efforts, we used the Global Burden of Diseases, Injuries, and Risk Factors Study, GBD, 2023 framework to generate and analyze estimates of cancer burden for 47 cancer types or groupings by age, sex, and 204 countries and territories from 1990 to 2023. Cancer burden attributable to selected risk factors from 1990 to 23, and forecasted cancer burden up to 2050. Cancer is a major contributor to global disease burden, with increasing numbers of cases and deaths forecasted up to 2050, and a disproportionate growth in burden in countries with scarce resources. The decline in age-standardized mortality rates from cancer is encouraging but insufficient to meet the SDG target set for 2030. Effectively and sustainably addressing cancer burden globally will require comprehensive national and international efforts that consider health systems and context in the development and implementation of cancer control strategies across the continuum of prevention, diagnosis, and treatment. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Pathogenic variants, family history, and cumulative risk of breast cancer in U.S. women. Question: how do variants in predisposition genes, family history, and other factors impact breast cancer risk in the general U.S. population? Findings: in this study, including 67,692 women, those with a pathogenic variant, PV, and a first-degree family history of breast cancer, had an estimated 22.5% risk of breast cancer by age 50 years, and a 51.2% risk between age 50 and 80 years, compared with an estimated 9.4% risk by age 50 years, and 29.7% risk between ages 50 and 80 years in women with a PV but no family history. PVs were rare. Risk among PV carriers varied by family history and other factors, meaning women with PVs can use these risk estimates to guide screening and prevention decisions. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Efficacy of acupuncture in irritable bowel syndrome. Action: a multi-center randomized controlled trial. Background and aims. Irritable bowel syndrome, IBS, affects 4.1% of the adult population, with many reporting ongoing symptoms despite first-line therapies. Acupuncture is widely used for IBS, but without sufficient evidence. We aimed to assess the efficacy of acupuncture in patients with diarrhea-predominant IBS, IBSD. Conclusions. Acupuncture improved abdominal pain and stool consistency in patients with IBSD, with sustained efficacy over 18 weeks. The results of this trial suggest that acupuncture may serve as an alternative treatment for IBSD. Here are the articles from Clinical Gastroenterology. Safety and efficacy of endoscopic submucosal dissection for rectile neoplasms extending to the dentate line, a systematic review and meta-analysis. Objective. Endoscopic submucosal dissection, ESD, is a superior, minimally invasive technique compared with other snare-based endoscopic resection techniques for rectile neoplasms extending to the dentate line, RNDLs. However, performing a successful ESD in the anal canal can be challenging due to vascularity and limited scope stability. In this meta-analysis, we aim to evaluate the safety and efficacy of ESD for RNDLs. Conclusions. ESD is a safe and effective option for managing RNDLs with a low recurrence rate. Adverse events such as post-procedural perianal pain, post-procedural bleeding, and anal stenosis seem to be more common compared with colorectal ESD done for more proximal lesions. However, these can typically be managed conservatively or with minimally invasive endoscopic techniques. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Dolutegravir/lamivudine, for maintenance of virological suppression in persons with historical suspected or confirmed resistance to lamivudine. Week 48 results of a single-arm, open-label, multicenter, phase IA clinical trial. Background. We investigated the efficacy of dolutegravir/lamivudine for maintenance treatment for people with human immunodeficiency virus, HIV, PWH, and previous lamivudine resistance. Conclusions. After excluding lamivudine mutations in proviral DNA by population sequencing, dolutegravir/lamivudine effectively maintained virological suppression in PWH with CD4+ greater than 200 cells/M3 and history of lamivudine resistance. Notably, no treatment-emergent resistance was observed. Next, we will be discussing articles in the field of rheumatology. Here are the articles from Journal of Clinical Rheumatology. Knowledge and Behaviors in Reproductive Health Among Mexican Women with Autoimmune Rheumatic Diseases, Cross-Sectional Study. Background. Reproductive health is a critical issue for women with autoimmune rheumatic diseases, ARDs, yet significant gaps in knowledge and practices persist. While prior studies have largely focused on populations in high-income countries or specialized clinics, there is limited evidence addressing the reproductive health behaviors and challenges in middle-income settings, where disparities in healthcare access and counseling are pronounced. This study aims to assess reproductive health knowledge, contraceptive use, and pregnancy planning among Mexican women with ARDs, identifying specific areas for improvement in education and counseling to bridge these gaps. Conclusions. This study identified critical deficiencies in reproductive health knowledge, limited pregnancy planning among Mexican women with ARDs, and that half of the participants reported inconsistent contraceptive use, underscoring a significant gap in counseling and guidance. The findings emphasize the need for targeted educational programs and standardized counseling protocols to improve global reproductive health guidance provided by healthcare professionals. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Contemporary Burden of Cardiovascular Disease in Pregnancy. Insights from a Real-World Pregnancy Electronic Health Record Cohort. Background. Cardiac and vascular complications are the leading causes of maternal mortality and morbidity, but the contemporary burden of and secular trends in pregnancy-related cardiovascular complications are not well characterized. We developed a multi-institutional electronic health record-based pregnancy cohort, with rigorously defined cardiovascular outcomes to examine trends in prevalence of maternal cardiovascular comorbidities and cardiovascular disease, CVD, and incidence of pregnancy-related cardiovascular complications. In a large-scale electronic health record-based pregnancy cohort, both the prevalence of maternal cardiovascular comorbidities and CVD, as well as the incidence of pregnancy-related cardiovascular complications within 1 year postpartum increased over the course of 2 decades. Our findings demonstrate an alarming rise in pregnancy-related cardiovascular complications in a contemporary real-world setting and highlight pregnancy as a crucial life opportunity for cardiovascular health optimization. From JAMA Cardiology. Efficacy and tolerability of finerenone according to the use and dosage of diuretics. A pre-specified analysis of the FINEARTS-HF randomized clinical trial. Question: what are the safety and efficacy of finerenone in patients with heart failure with mildly reduced or preserved ejection fraction, HFmrEF/FPEF, receiving background diuretics? Findings: in this pre-specified secondary analysis of patients with HFmrEF/FPEF in the FINEARTS-HF randomized clinical trial, the efficacy and safety of finerenone were consistent across subgroups defined by diuretic use, including those receiving only loop diuretics, less than or equal to 40 mg and greater than 40 mg of furosemide equivalent, only non-loop diuretics, and a combination of both. Finerenone reduced the need for loop diuretic dose intensification and decreased the mean loop diuretic dose compared to placebo, meaning these findings demonstrate a diuretic-sparing effect of finerenone in patients with HFmrEF/FPEF. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Evaluation of aldosterone suppression by cinnarizine, a putative CAV1.3 inhibitor. Context: primary aldosteronism (PA) is commonly caused by somatic mutations of CACNA1D encoding CAV1.3, one of the 4 L-type calcium channels. The over-the-counter drug, cinnarizine, fits the CAV1.3 crystal structure pore domain. Objective: we hypothesized that CAV1.3 blockade by cinnarizine may achieve similar or greater reduction in aldosterone secretion than non-selective CAV1.21.3 blockade by nifedipine. Conclusion: a CAV1.3 ligand, cinnarizine, reduced aldosterone secretion from adrenocortical cells, but at maximum soluble concentrations was less effective than the non-selective calcium blocker, nifedipine. At clinical doses, cinnarizine did not reduce plasma ARR in patients with PA, and, as in vitro, was inferior to nifedipine. The limited efficacy of high-dose nifedipine may be due to incomplete CAV1.3 blockade, or to a role for non-L-type calcium channels in aldosterone secretion. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. The association between mechanical power within the first 24 hours and ICU mortality in mechanically ventilated adult patients with acute hypoxemic respiratory failure. Background: despite the widespread adoption of lung protective ventilation strategies, mortality among patients receiving invasive mechanical ventilation, IMV, remains high. Mechanical power, MP, integrates various variables responsible for ventilator-induced lung injury, and has been associated with mortality in patients with ARDS. However, the impact of MP on ICU mortality in the larger group of patients with acute hypoxemic respiratory failure, AHRF, has not been well established, and previous studies have reported inconsistent thresholds for predicting outcomes interpretation. In this study, exposure to high MP within the first 24 hours of IMV was associated with increased ICU mortality in patients with AHRF. The absence of a consistent safe threshold suggests that reducing MP at IMV initiation may be a strategy to improve outcomes, warranting exploration in clinical trials. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. 1-year change in quantitative computed tomography is associated with meaningful outcomes in fibrotic lung disease. Rationale: whether change in fibrosis on high-resolution computed tomography is associated with near and longer-term outcomes in patients with fibrotic interstitial lung disease, FILD, remains unclear. Objectives: we evaluated the association between 1-year change in quantitative fibrosis scores, data-driven textural analysis, DTA, and subsequent FVC and survival in patients with FILD. Conclusions: 1-year change in DTA score is associated with future disease trajectory and transplant-free survival in patients with FILD. DTA could be a useful trial endpoint, cohort enrichment tool, and metric to incorporate into clinical care. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. The Association of Long COVID and CKD, findings from the National Clinical Cohort Collaborative. Baseline CKD, even mild, is associated with a higher risk of long coronavirus disease, COVID, in patients with severe acute respiratory syndrome coronavirus infection. Among those without CKD at baseline, long COVID is associated with a higher risk of developing new CKD and faster kidney function decline. Associations between long COVID and CKD/kidney function decline persist after matching, adjustment, and accounting for the competing risk of death. Here are the articles from Kidney International Reports. Effects of combination treatment on renal endothelial function in type 2 diabetes mellitus. Introduction. Recently, we demonstrated that a combination therapy with empagliflozin and linagliptin, E+L, in patients with type 2 diabetes mellitus, T2DM, induced changes in renal hemodynamics. The purpose of the present study was to analyze the influence of nitric oxide, NO, activity of the renal vasculature on the described changes of the renal hemodynamic profile. Conclusion. Renal NO activity emerged as a determinant of the renal hemodynamic response in the combination therapy of E+L, but not in the combination therapy of M+I. Our study provides evidence that the treatment effect of sodium glucose cotransporter 2, SGLT2, inhibitors may be contributed at least partly by the renal NO activity in patients with T2DM.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.